Good morning, everyone. Welcome to Workforce Optimization webinar. We're going to give it another minute or two before we get rolling, but great to see everyone this morning. All right, let's dive in. Thank you, everyone, again for joining today's webinar, Workforce Optimization Inside Integris Health, how physician enterprise strategies powered workforce optimization. I'll be your moderator today, Pete Creamer, Executive Director at Venn Workforce Optimization. And we have my great friend and colleague, Abe Burrell, Director of Physician Enterprise Talent Strategy. I'm excited to have this conversation because Integris has been an awesome partner in rethinking what workforce optimization can look like when technology, process, and partnership align. Before we get started, I'd love to keep the audience as engaged as possible today. If you could drop in your name, organization, and what you're trying to get out of this webinar today. Our goal is to shape this webinar around what everyone is looking for, and then at the end, we'll answer any questions that you may have. So, Abe, welcome. Before we dive into Integris' journey, I'd love to hear a quick overview of who you are and what your day-to-day operations looks like as the physician recruitment leader for such a large healthcare system.
Sure. So I'm the Director of Physician and Provider Recruitment for Integris Health. So we're the largest not-for-profit health system in the state of Oklahoma. We have a total of 16 hospitals. They're kind of broken up across the state. We've got some that are rural, some that are in more metro area. And of course, we have a range of primary care and specialty clinics and all of the associated places where physicians and providers work like you'd expect with a good-sized health system. Right now, we have just over about 830 or so employed physicians and APPs across the organization. And so with all of that, of course, we have a fair dose of locums that we utilize as well. I've been in, healthcare recruitment for about 20 years. I've worked in a variety of both agency side and internally, large organizations, small organizations, and now Integris Health. I would kind of classify it as somewhat of a mid-sized organization as far as healthcare goes. So that's a little bit about my background and what we have happening currently with Integris.
And out of curiosity, Abe, what was the first thing that got you interested in the idea of partnering with the MSP, VMS, or workforce optimization solution like Venn at Integris?
So when I came on, our locums process set up everything we were doing to ensure we had the patient coverage that we needed was somewhat fractured. It was different leaders across the system kind of getting their own. We were partnered with, I would say at least 20, maybe 25 different locums agencies, depending on who had a need and when it was going. And we didn't have a lot of true visibility to what was happening because it was, across so many different service lines and different facilities and different service line leaders getting what they needed. It was pretty fractured. And so we started initially talking with our nursing partners. So the way we're structured, the TA component at Integris, physician and provider recruitment is in its own kind of swim lane, and then the rest of talent acquisition is separate from that, which includes nursing and every other service line. And we started an RFP with the entire kind of TA group and our own workforce development team to look at what options could be available that would satisfy the need for all of our temporary staffing. And we were looking very closely at what does that look like on the physician side. And since that's the part of the organization that I drive, that's where we looked closest was how do we make sure we take care of everything physician and APP related.
Yeah. I guess in the big picture, what do you think the reason for you was to kind of split those apart from nursing and physician recruitment?
Yeah, it's a good question. So I should have unpacked that a little more. We were doing the RFP with that big group, and we had several different providers of workforce development come in, MSPs, and different groups to present. And we found pretty quickly that there was kind of a two versions of it. So some of those organizations had a history of nursing, and they did a really good job of the temporary staffing for nurses and creating those internal float pools and all the things that you really need on the nursing side. And we also realized that there were other programs and MSP platforms that were great for the physicians and did a really good job with locums. And it was because I think their background was primarily on the locum side or physician based. And so it became pretty clear that it's kind of a two-tier or two-version platform out there. You either get one that does really good on nursing, and then it's kind of light on the physician APP side, or vice versa. And it didn't ever seem, as we dug in through our RFP, it didn't feel like we really ever had a platform that could do both and do it well. As you started to unpack, you found, oh, they do this really well on the nursing side, or they do this really well on the physician side, but it didn't translate across the platform. So we kind of mutually agreed we were going to part ways with the other team, and they were going to work on a platform that really served the needs of the nursing leadership, and that we would look at those that would do a better job on the locum side with physician and APPs. And so we just decided the best fit was really to utilize two platforms instead of one. And I know people are like, but that seems like you're overcomplicating it. The underwriting component there is we had to make sure that we met the needs of the organization, and that meant we had to really look at two different platforms that focused on what we needed.
Yeah. Well, thank you for breaking that down for us today. I know that's a big question with a lot of organizations.
It is.
Let's dive in real quick to the session overview. So I want to identify the key operational challenges Integris faced. We want to explore the impact of a high-touch, high-tech workforce optimization partner, Venn being the case for Integris. And I want to apply the lessons from Integris Health's implementation early wins so other organizations can see the outcome. So diving in, I think I really want to start with the challenge before the change. Let's start from the beginning. Before we started working together, what was the biggest challenge Integris faced in managing locum tenens staffing?
So yeah, I kind of touched on that a little bit. The just the nature of having so many service lines that needed locums, off and on. Sometimes it was, to cover, someone who was out on a leave. Sometimes it was we had someone who had resigned, or we had a new service line that wasn't fully up to steam yet. All the different reasons why you would need to implement locums for a particular service line. But it was really difficult to have our arms wrapped around all the different needs. And so there was a lot of email back and forth. I think you put that heavy email volume. It was a lot. But also we started to, we wanted to track it. So we started using Excel spreadsheets, everybody's favorite Excel. Great platform. But as you start to, flesh out everything that is happening across 16 hospitals and, a lot of service lines, it becomes overwhelming to keep all of that up to date. We did bring on our own, around that same time as we were exploring platforms, we brought on our own internal locums recruiter, and her job was solely just managing locums across the system. Like that's how much we had. We had to have our own internal recruiter that could manage that. And as we dug in, and she did a phenomenal job, helping us to build out an Excel spreadsheet that could track it pretty well. We were still just behind the curve on being able to keep up with emails and connecting with our operations leaders, and where do the confirmations go and who's saving those. And there's just a lot of components to managing day-to-day workflows for locums. And when there's so many coming through, like where do you keep it? How do you manage it? And how do you go back and reference it? There's always a situation where it's like, what were the details on that particular locums coverage? When were they really going to work? And where is that calendar at? And when you have so many different service line leaders that need that kind of quick answer and what's happening and want to be able to see, have some visibility to it, it became very clear we needed more help. We had to have a platform or something to help us really dig in and see what was happening there. And now another component that was a real challenge for us is tracking locum spend. We didn't have a good mechanism for that. Of course, our AP team does a great job processing invoices and getting them paid. And anyone that's dealt with a large organization and their AP team, you realize you don't really get reporting on that for like 60 to 90 days. So it was like we wanted to know what's happening on locum spend, but we really couldn't see that because those reports wouldn't be available for 2 to 3 months from when we actually spent the money on a locums provider. And so just that delay in reporting and not being able to see it in real time, or even, to be honest, quickly, just because that's the cost of business. It takes time for all that to be put through the system and a report, fed out. And we really needed to know in a more immediate fashion, like what's happening, what's the spend, and being able to report that out to executive leadership in the hospital is also important too. And we needed to get our arms around that. We didn't have the ability to do that, and started, really digging in. What can we do to, get that kind of information to us? But the other part that was a challenge for us is sometimes a service line leader is desperate to get a fill. And so, because they're trying to make sure those patients get seen, and ultimately, having our patients taken care of is number one. Those service line leaders would reach out to whatever staffing company could get them a quick turnaround on a physician or an APP to fill that need. Like, I've got a critical care night position, and I need it filled right now. And they would reach out, and we have partners in staffing agencies that they were doing a good job. They were doing a great job of taking an entire calendar and saying, we're going to fill this in with these locums providers. But we didn't have the kind of gatekeeping over that. It was, we had to have it filled, and we handed that over to our partners and said, can you help us? And they would. But it was still very fractured, and we didn't have the ability to really dig in and get those bill rates competitive, because we were really in a reactionary mode and not proactive at that point. We were just kind of getting what we could get. Didn't know if the bill rate was great, but we knew we had that position filled. We would take it and run with it.
Awesome. I think it really tables us up for how executive leadership looks at this, right? When you were talking about the idea of workforce optimization, obviously y'all went to an RFP and the decision was made at a high level to say, hey, we need something. How did leadership view the idea of workforce optimization? Obviously there's definitely a cost component around it.
Yeah.
Strategic initiative. Can you dive into that a little bit further for me?
Yeah, I mean, our leadership is very supportive of all of us working hard to take care of the needs of the system. And so, of course, everything has a cost, and we all know that, to get the results we need, there would probably be a cost to it. But there was also a very high cost of not knowing that we were getting, the best for our money. Did we know that we had the best bill rate? Did we know that we were getting the best providers? Did we get did we get an opportunity to select among several providers, or did we just have one provider that was given to us and we were like, we know we have that hole and we're going to fill it? So when you talk to executive leaders, they want to know we're providing the best patient care to our patients, and so that we want to be selective about who we fill the roles with, but we also want to make sure that we're taking care of the organization and the bottom line, and making sure that while everyone knows that physicians bring revenue to an organization, but they're still we have to be financially, fiscally responsible with all the choices that we make, including the physicians that we're bringing in for our locums coverage. And so, our executive leadership was very supportive of that, and knowing there may be a cost on the front end, but ultimately we want to get to where we're driving savings and making sure we're making the best choices financially for the organization.
Yeah, and over your couple of years with Integris, was there like one big turning point or one big situation that happened that you were like, we really need to have a technology, or we really need a solution for physician recruitment over here at Integris?
I wouldn't say there's necessarily one big standout event that kind of triggered anything. We did have some new service lines that needed to get ramped up quickly. And those were kind of what prompted us to really dig in and say we need to have line of sight over every single physician that's coming in, and make sure that we're able to keep track of whether we had good bill rates, great bill rates, and that we had every shift filled regularly. Because that was the other challenge when you're working through an Excel spreadsheet and doing the best you can through emails. Sometimes there could be a shift that slipped through the cracks, or you don't know, especially if you get, it happens. A physician can't make it to their assignment, or they get, some other opportunity. They decide to stay permanently at another organization. We had that happen. You have to transition quickly, and if you didn't have the ability to look and see an overall big picture, sometimes you would miss those things, or you have a potential for missing those things. And we wanted to make sure, as we were building out these new service lines and getting some locum support to get us where we needed to be before we could, bring in those permanent physicians, that we were able to handhold along the way as much as possible and have that visibility.
Yeah, I think that sets the stage really nicely. And ultimately, we always talk about it, and I talk about this every day with my clients, is how do we balance that cost savings and the competitiveness between the agencies, but also for any practice leader or program manager, they need to fill a job, right?
Yeah.
They need a body in there for patient care. And ultimately, that's the balancing act. How do we do it fast with a good quality provider at an efficient price that's good market rates? So let's transition over to why workforce optimization partner and how you selected your partner, Venn.
Yeah.
At a high level, let's just dive in.
Yeah, so like I said, we started out and we kind of realized there were two tiers. There was those that were really focused heavily on the nursing side and did a great job there, and then those that had more of an origin point in locums. And so, as we were looking to really focus there, those were the platforms that we looked at most closely. And there's a variety of different platforms out there. Some of them are kind of big, and they have like every agency you can imagine in there, a very large platform. And then others were more of a curated panel, smaller panel of agencies in there that you work with more closely. And for us, as we were looking at those different platforms, I wanted to make sure that we didn't lose the personal touch with the agencies. And so when you bring in a VMS, there's going to be this natural kind of little bit of friction. The agencies are like, wait, you're putting insulation between us and you. Like we have this relationship, we want to keep it going. And I, wanted to make sure with the panel that we had, we were able to maintain those relationships. We didn't want to, alienate any agencies. We didn't want to, say, oh, you can't contact us at all. Or any of that, kind of situation where you kind of end up with souring a relationship a little bit. We didn't want to have that situation happen at all. And so as we were looking at platforms, part of it was we wanted to maintain the high touch. We wanted to make sure we still had good communication with our partners. And so that really helped us to narrow the field pretty quickly to those that had a more abbreviated panel. And that was one of the things that stood out when, you and I started talking at the beginning of this, 8 months ago, 9 months ago, it's been a while. It might have been a year at this point. I was like, we don't want to lose the personal touch, and we want to have a smaller panel to where we can maintain that. Having a large panel of agencies with, say, 100 or 50 or 75, impossible. You cannot maintain any kind of relationship across all of those. It's so big. And then you also run the possibility of, when you've got a need, and we're in Oklahoma, not a huge state, not a whole lot of providers out there that have an Oklahoma license and they're ready to go. So when you do have a need and you put it out, if there's 75 agencies that all reach out to the same 10 physicians that have that specialty or in state, they get overwhelmed by that sometimes. And then they're like, this is too much. We don't want to, we're not going to engage there. And so knowing that we have a small panel, there's going to be fewer of those organizations reaching out to those physicians that we need the help from, and we're able to maintain high touch. That was really important for us. And really one of the things early on that you and I talked about was, how do we maintain those relationships? It's by keeping that panel small. It was real important.
Yeah, and I'm really glad you gave us a chance. I remember the first time we talked, I think you said, Pete, I think we're a little too late. We're already in this RFP, and we have some contenders. So
Yes.
I'm glad you opened the door and gave us an opportunity. I'd love to talk a little bit more about the uniqueness of Kimedics, right? Kimedics is our VMS, and for everyone on the call, a VMS is the system that supports everything that we do, the technology. Love to talk a little bit more, because you said it was a big decision for you all between nursing and physician, and should we do it all on one platform or should we keep it separate? And ultimately you decided to keep it separate because Kimedics is purposely built for locums only. So I'd love to dive in a little bit more on that.
Yeah, absolutely. The scheduling feature in there gives us kind of the overview of an entire service line. We can also go down and look specifically at the individual locums providers, that when they get submitted, but also all of the shifts that they have accepted and where they're working. And so it gives us that kind of bird's eye view when we want it, but also gives us the ability to drill down into individual assignments or individual providers and see what they've been doing, what they're scheduled for, what their future schedule is. I really like having that ability to look down the road and see, okay, this physician is scheduled here, here, and here. That service line has these physicians scheduled out through, March of next year, whatever the time frame is. We can see all of that, and it's in real time. So that component is so helpful. I mentioned that earlier on the spend piece. Like we, didn't have that visibility real time. It also shows us the spend. Like we see what the bill rates are, we see what current spend is, we see what future spend is. And having all of that as a leader, having all of that information in front of me and able to pull it. And then when I get, questions from an executive or I get questions from a service line leader, I'm able to pull that information and present to them, and give them a quick turnaround on those answers, as opposed to, give me a couple weeks, I'll talk to AP and I'll pull a report and I'll put all this together and bring it to you, which is what we kind of had to do in some instances before. Or going back to our Excel spreadsheet, we utilize that quite a bit. But again, that is only as good as the data that's in there, and making sure someone didn't make a mistake on the particular column where they put the formula in wrong. While we're all pretty thorough with Excel, we're not pros by any means, and having all of that in Kimedics is wonderful. We don't have to try to massage a spreadsheet or anything like that. We're able to just go in and pull it and deliver the results to our own internal stakeholders as they need it to.
Yeah, and I love that you said that. I think in the locums world, for my career in locums, I think so much of it is living in the moment, right?
Yeah.
What do we need? When do we need it? How do we get it filled? But that proactive approach, or the forecasting, right? Recruitment is evergreen. It continues. So really understanding where your pain is going to be in 6 months, how much you're going to be spending in 6 months, and how do we permanently recruit or proactively recruit in our market to fill some of these long-term gaps?
Yeah, absolutely. And the other thing, that this was a huge selling point for me, honestly, with Venn. When I started to meet the team and get to know the different leaders in the organization, And Sarah, who's on your team, we started talking, and I was like, "Well, what's your role with Venn?" And she goes, "Well, I, help the different healthcare systems that we work with to figure out how to use locums less." And I was like, why? Like, I was like, that seems counterintuitive. And she was like, because we are committed to helping those systems to create, workforce development that works for them and helps them to get what they need, save money, but also be a true partner. And that I thought was huge. I was like, no. And so I honestly, after we had that conversation, I started asking the other organizations that we were, doing the RFP and talking to their leaders about their platforms. I started asking, well, do you have a workforce development person on your team who helps us to figure out how to use locums less? And the answer invariably was no. No one else had that. And I was like, that's a huge, just marker of how Venn partners with the health systems that they're wanting to work with. It's not just a customer. It's not just, hey, we brought someone else in the door. We're able to have them as part of our platform. No, it's a true partner who is working with us to get what we need, both internally and externally, take care of our patients, but then also to only utilize the amount of locums that we need. I don't think there's, anyone that's confused that locums is going to go away. Like, we all need it. There are very good reasons for utilizing it, but also it can get overutilized. And so having someone dedicated on your team to help us dig into all of our spend and all of our needs and say, hey, you can make cuts here, you can make changes there, and really partner, not just treat us as another customer. Really, really was a big selling point for us.
Yeah, it goes from that like factory model of just packaging and delivering to more of a consultative partner. And that's Sarah O'Neill you're referring to. She is one of our VPs over here at Venn, and she is a rock star, ER nurse by trade, but then she's actually run some departments. So she really gives you that operational look at it to say, hey, like, do we need a locum in this space? Or
Mhm.
is this, are we billing a little bit incorrectly here? How are we managing this provider? So I love that you put that in there. It kind of pushes us into our next question. We like to break it up VMS as the tech and MSP as the people. Anything else about the people over here at Venn that you've really enjoyed working with?
I mean, I can't say it enough that it feels like a true partnership. They're all along the way from the very big initial conversations that we started having with Vin to today. It feels like a partnership. It feels like well, just to be honest, if I have a need, I reach out to you, or I reach out to Sarah, or I reach out to our dedicated program manager, Sunny. We have the, direct line to be able to reach out, whether it's email or it's text or a phone call. And they're regular high touch points with the team. So I have full confidence if there's a challenge or a problem that crops up, that we'll get a quick response. We get a really quick turnaround and great follow up. So having that organization that really treats us as a partner and gives us the ability to connect and talk on a regular basis and to work through any of the challenges. I mean, let's be honest. It is not easy moving from a multi-agency, everybody kind of doing their own thing process to, okay, we're going to go through a platform. We're going to bring everybody in the door, and we're going to follow a set procedure. That's a challenge. That's tough for anyone. And of course, there's bumps in the road. There's going to be, issues that come up or things you didn't expect. But having the ability to connect with the entire Venn team whenever needed and work through those challenges has been just huge for us to be able to get through.
Awesome. I love to hear it, Abe. It's that consultative approach, right? We want to consult, we want to help you make tough decisions, and we really want to help Integris into the future.
Right.
Um, s- so let's dive into implementation and early wins. I think this is really important because obviously the better a system does implementation and the better we can actually help you with that change management, the better the program's going to work out long term. So talk to me a little bit about from the start, like implementation can make or break a program. Like how
Yeah.
did Venn make that transition easier for you and your agencies? Because they are a very big part of this puzzle.
Yeah, absolutely. The implementation started even, well before we truly implemented the platform. And that was when the Venn team came on site. They have what they call a vent session, where, you kind of get in a room and walk through, here's all the challenges that we have with utilizing locums. And it was like, no holds barred. What are your problems? And we just walked through, like I had my entire recruiting team, not just the locums recruiter, but all the recruiters were there. We had the operations leaders and as many of, we had our credentialing leader come. We had as many of the different leaders as we could in the room. And we just walked through all the different steps of locums, where the pain points are, where, sometimes we could have some challenges or issues, and walked through all of that. We spent the day with your team. The event session was great, but then just walking through, here's what's going to happen from day one on, and here's how we're going to make sure we cover the bases and get over the hurdles. And so again, that was huge for us to have you on site. You came in, all of the team leaders were able to meet with the Venn team and know, like, this is who I'm dealing with on a regular basis, and make that kind of personal connection. So that when we did have to reach out, like, okay, I think we may have a challenge here or an issue here, they knew who they were connecting with and had already met them in person. And so having that, front end planning time and ability to say, let's process map out our, everything we're going to do for implementation, and make sure that we catch any of the issues or errors. And honestly, I think anyone who's been in physician recruitment for a while knows that credentialing is just a challenge. Like, it's hard. There's a lot that goes into it. There's a lot of moving pieces. You're working with physicians that are having to provide a bunch of information that they don't always have access to readily. And so the Venn team even sat down with our, director over the whole credentialing department, and just, same thing, asked her where the pain points are. Getting locums providers credentialed is probably even a step up from just regular credentialing, because a lot of times it's in an accelerated fashion, and we're trying to move it even more quickly. And so the Venn team taking those, the early time to plan out, make sure we caught any bumps, bruises, potential issues, and then helped us to make that plan ahead of implementation was huge.
Yeah, let's dive into the noise a little bit. I know you mentioned that. How's it been going? How do we help streamline that noise, the calls, emails?
Yeah.
We all know that patient care comes first to a lot of these program or specialty line leaders, and
Yeah.
ultimately they don't have a lot of time to answer calls and emails from all these agencies. How's that been going since we implemented?
Yeah, it's definitely better. There's always going to be new agencies that come around, and they're trying to get in and talk to people. But the great thing is we're able to say, we have a partner in Venn, and if you're going to have any interest at all in working with us, you would need to talk with them. And so any new agency that we don't have a relationship with currently, and we're not looking to pursue anything right now, we're able just to route over to our program manager with Venn, and let her talk with them and kind of set the table for what would be expected if they were going to join the panel, and kind of run with that. So just from on the recruiting side and handling agencies that come through, we're able to funnel them that way. Service line leaders, the same thing, because they get those same calls, because agencies know, well, you find the person who's experiencing the most pain, you might get something to happen. So it's the same thing. And we tell the service line leaders, if you get any of those calls, just send them to us and work them through. So just, on the agency side, that really helps. Internally, as we're talking, we're lining up locums providers and we're getting them set up to work their assignments. The same thing happens. We're not relying on who had an email with a confirmation in it, and did anyone put that in the right folder and track it. Again, that's all in the platform, and so we're able to just circle back and see everyone's on the same page. Our ops leaders have access to the platform, our recruiting team has access to the platform, and they're all able to kind of go in there and see what's approved, what's not, what's open as far as those, sometimes it's, did we open a locums position for that, night shift APP? Did we not? It's all in the platform, and we can just send our internal team there too to look and say, okay, it's in there or it's not, we need to add it. And we don't have to have as many emails back and forth or phone calls desperately saying, I didn't open that one rack, because I forgot or whatever. They can just go in and see, what's approved, what's not, and we can get things moving.
Yeah. I know you mentioned earlier about the smaller curated agency panel. Anything else you want to add to that? I know that's something that was very important to me when I joined Venn, was keeping up that quality and keeping down the cost while maintaining a standard of care. So anything else from a smaller curated panel that you want to add?
Yeah, I think it really does, beyond just being able to maintain that relationship with the agencies, and we're able to do that because we're not spending as much time, chasing down a lot of potential leads or chasing down paperwork. We can spend the time to actually connect with those agencies when we need to and let them know, like, hey, these physicians were great, these apps were great, let's make sure we continue to bring them back when we have a need, and we're able to have more of that. We're not just desperate trying to hurry and rush. We're able to take our time and talk through what's going good, or if there's an issue or a problem, we're able to work through that. And having that smaller panel allows us the ability to do that because we're not dealing with so many different organizations. And instead of having one service line with 5 different agencies, providing some of those providers, we're able to kind of get that narrowed down a little bit and spend more time developing the quality and less time kind of chasing all the extras that go along with having a lot of agencies involved in your day-to-day flow.
Yeah, and if you get the right agencies, fulfillment happens. So I think that's a
Yeah.
great point. Talking more about the data reporting and analytics, as we continue to evolve and roll out more things for reporting and analytics, what are you the most excited for, the most looking forward to?
So the future forecasting part is the part that I get the most excited about, and I know Kimedics is rolling out some updates that's going to give us even greater visibility to that future forecasting. I think that's where I probably have the most excitement, just for us to be able to show. Here's where we're going, and here's where we know we're going to need to have some additional spend because we know that locums will be used there, and also to show this is where we're able to reduce. I think everyone's budget is in the same situation. You want to make sure you're taking care of the organization, but doing so fiscally responsible and being able to show where we can make improvements that will cut the cost is just as important as making sure we show where if it's going up and we're going to have more spend. So having that kind of deeper dive on our future spend for me is huge. Like, I'm very excited for where that's headed and what we're going to be able to see with it.
I love it. Well, Abe, you keep us on our toes, and we appreciate that. It keeps us sharp. I think I mentioned that day one. I was like, I'm very transparent, and you were like, I am as well, and I will tell you what the good, bad, and ugly, and everything in between. And you really appreciate that because every day we want to evolve and continue to grow and get better for Integris and all the clients we serve.
Yeah.
Um, so I wanted to transition real quick for the audience to keep everyone engaged. If you could, I put up 4 prompts here in the common client concerns around tech, MSP, workforce optimization, adoption. If you could in the chat, please just click 1, 2, 3, or 4 on what your biggest concern is around, potentially evolving into a space where you have a VMS, MSP, or workforce optimization technology. 1, the technology implementation process feels like a major change. 2, the internal team already has established processes, does not want their process to change. 3 is there's concern of MSP takes over, internal team members may lose their roles and responsibilities. Or 4, the organization does not currently see the long-term value of adopting a workforce optimization solution. I'll give everyone about 30 seconds to toss in a number into the chat, and then we will proceed. All right, I saw a few responses, and it looks like 1 is actually the biggest concern. Abe, I might even just pass this one over to you so you can talk through it. Was it a major change? How have you felt so far with everything that Venn's brought on for Integris?
Yeah, I mean, I would say yes, it's a major change, but not a major change like with a hurdle that's not able to be overcome, if that makes sense. So, the technology implementation, I mean, it's a web-based portal, and you're using that as you would any other, kind of platform. It's easy to access. It's not like you're trying to get a tie-in with your current, platforms or, anything like that. So as far as like the tech piece, I guess I would say it's not a major change. The big change is the mindset change really for leaders that we want to make sure we have everything going through a single point as opposed to everybody just grabbing what's easy or right in front of them. And so I think that's the part of the change that's the biggest. And honestly, as you work with your internal stakeholders, that's probably where you're going to have the biggest pushback because you're going to come across that medical director who's overseeing a critical service line who knows that one specific agency has provided them some great candidates on a consistent basis, that locums providers that are in there, and they trust them. And you don't want to erode that trust. You don't want to say, okay, I know you've used them. We don't want to use those providers anymore. We want to use these others. So it is a partnership, and you're working with them, and you've got to steady those nerves internally, but also let them know your goal isn't to take anything away. Your goal is to make everything better. And so you're working through the change that brings things to it's a better situation, not a more complex. It's not taking away any of their ability to choose the physician that's the right fit for that special service line, or making sure that it's taking care of their patients the way that they would want to. You're not taking any of that away. They're still forefront on making choices on which locums providers are the right fit. They're still able to, have a say over that schedule and what it looks like. And so I would say any organization that's looking like, how do we overcome this? It does seem big. You start with the conversations. You start with the low hanging fruit of talking through, well, where are your pain points? I know you have trouble because we haven't been able to get this filled permanently, and tell me about your pain points, and let's talk about how we can work through those. I think that is the key to making sure that you get that internal buy-in, letting folks know you're not taking away, you're adding to, and it's value add that you're bringing, not taking away.
Yeah, I don't think I could answer that any better myself, Abe. Thank you for that.
Yeah.
And ultimately, too, I don't think it's as long as people think. I think there's a lot of people out there, with the EMR implementations or integrations, the Workday or other systems internally. Those could take 6 to 12 months,
Correct.
whereas our average is 30 to 45 days. And we're going live. And if we need to do some integrations with some technology, we can do that once we go live. But let's get this started. Let's get the panel curated, the contracts out, and everything running.
Yeah, I totally agree there.
So, broader impact and lessons learned to kind of wrap it up today. You've now seen what a managed data-driven model looks like in action. What advice would you give other organizations that are still trying to manage locums the old way?
Quit doing that. I mean, honestly, yes, there's a challenge to implementing a new technology. There's always going to be a challenge with that. When you start to see the light at the end of the tunnel, and you're like, okay, we are now on this platform, we're seeing the data come through, we're able to get the service lines covered that we need to. That's when okay, this was the right decision, and we want to make sure that we continue this partnership. And I would say just start by asking questions. If it's you're doing locums the way you've always done it, start asking questions like, why do we do it this way? Is this the most efficient use of our time? Or does it feel like we spend more time tracking things down than we are getting things done? Those are the kind of questions you start to think, well, maybe there is a better way to do it. I would say, yeah, do your homework. Talk to multiple different platforms. Talk to a variety. Make sure that you're finding out all the bumps and bruises. Ask them for references. We did references on every platform that we checked out, and ask for the references, and then spend the time getting to know your peers and the other organizations who have gone through it, and say what worked, what didn't work. Why did you guys decide to do this? How did you get over the hurdles? If you want to know about Venn, come talk to me. I'm happy to fill you in on, even more in depth than we've gone through this morning on, what worked and why we did it. And I'll get into all the nuts and bolts for you. But, do that with any and every platform and take your time. I think the other part of that is don't expect to make a decision and have it done 2 months later. While the implementation can go quick, do your homework and take your time making a decision, and make sure that you have those internal conversations ahead of time with your different service line leaders, your executive leaders, so that they know what to expect. They know what's coming. And then start to methodically work through the process of making a selection that fits for your organization.
I love that. That's my favorite part about this job is being an educator. I talk to hundreds of clients every day that maybe aren't ready or maybe you're just thinking about it. But coming from a locums background and sitting in those agency seats of delivering candidates directly to facilities, I just want to help educate you. I want to help you understand what
Yeah.
is going on internally, how your process can be evolved, and where we can go. Last question for you, Abe, right here is, what has surprised you the most about the process? Anything you didn't expect? Anything you really enjoyed? Just kind of wrap us up with that.
Sure. I don't know that there were any true surprises other than, we expected to have challenges just because there was a lot that went into it, and it's an ongoing, we're covering for 16 hospitals for all of the providers that need locums coverage. And so, I think I'm probably more surprised that it has gone as smoothly as it has, even with a few bumps here and there. I feel like it has gone remarkably well. You kind of anytime you plan for change, you're kind of like, okay, I'm bracing for some bad things to happen, or so when do the wheels fall off? Well, that didn't happen. We're working through it, and it's so far going really well. We're excited to continue to move forward and tweak things here and there as we find different things that need to be adjusted. We'll make those adjustments, but surprisingly, it's gone pretty smooth, and I think that's probably the biggest surprise there because I expected it to be a little bumpier than it was.
Yeah, I love that, Abe. I'd love to open it up for about 5 to 7 minutes for questions. If anyone has any questions, please toss them in the chat, and we can answer any questions you might have. I'll prompt a question for you, Abe, if we want to
Sure.
jump in. Um, what do you think the biggest misconception is about MSP VMSs or workforce optimization partnerships in healthcare?
I think there's probably a perception that, they're just out there to take a cut of what the locums companies and the staffing or the health systems are doing already. That they're just how do you insert yourself in the middle to be a middleman? And so I have not experienced that at all. I do feel like, and our team feels like this has been a great partnership where we're working towards a common goal. And there are very positive results that have come out of this. So it's not just providing a middleman that kind of gets in the way. It hasn't been that at all, and I think that's probably a pretty common misconception out there. Like, oh, they're just getting in the middle and going to make it more complicated. That just hasn't been the case for us in this situation whatsoever.
Love it. And then we'll do one more, and then we'll give everyone a couple minutes back into the day. I know everyone's had a very busy day today. Um, I guess, we've talked about a lot about what advice would you give someone. Um, but let's talk like what kind of results should organizations realistically expect in the first 6 to 12 months?
I tried to be real upfront with all of the leaders about what we would expect to see out of this. Now, I'll say my what do they call it, a BHAG, big hairy audacious goal is I'd like for us to cut like 10% of our locums use, if possible, over the first 12 months, just to try to trim back. But ultimately, for us, the biggest goal is we want to know what's happening on locums. We want to have that true visibility to here's who we have in each of our facilities. Here's who's treating the patients. Here are the shifts that are covered. Here's what's not covered, and here's our spend. Like ultimately, that is our biggest goal. First 6 to 12 months, we want to have a full, complete picture of everything that's happening for our locums, and then be able to then work through all of the pieces of, okay, how do we optimize and make it even better down the road?
Love it. Well, in closing, Abe, I just want to thank you as always for being a great partner. It's been incredible to see your team embrace the change, embrace the technology, and really
Yeah.
set a standard for what modern workforce optimization looks like. At Venn, we honestly believe that success comes from high touch service and a high tech solution. Really combining those two to create a workforce optimization solution and helping you evolve into the new world of potentially less locum usage. So, again, I want to thank everyone for joining our meeting today. I hope everyone has a wonderful rest of the week and a great holiday season. And I do want to give a plug to Practice Match 2026. Will be held in Nashville, the beautiful Nashville, Tennessee, on June 28th through 30th. So hopefully I will see everyone there in person. And I hope you all have a great rest of your day.
Thanks a lot, everyone. Appreciate it.
Bye, everyone.
Let's see ya.